So just start off by stating your name for me and your title
Sure.
and how you spell it.
Yeah, my name is Joel, Joel, Tumlison, Tumlison, and my title is Physician in Outbreak Response.
Perfect. So just kind of give me a rundown in terms of the state of Arkansas right now when it comes to COVID.
Yeah, well, in recent weeks, probably the last three, we've seen increases in the number of new cases in Arkansas. We had been, an average of 200 or less for a good 2 months, starting in back in March, 2 or 3 months, almost through the end of May. But as June started, cases started to creep up, and now from that level of baseline of 200 or less, the last week that we have the full data for last week, I had an average of over 500 new cases, just over 500 new cases a day. So it is on the increase here, and that spread, is not located just in one part of the state, but is spread around various parts of the state.
Why do you think that is?
Well, some of it is the Delta variant. We've got increasing percentages of the samples we've sequenced are more and more Delta. The CDC estimated at the end of last week that, are based on the total samples for our region, which includes Louisiana, but Arkansas would be already at 30% of the variant samples sequenced. And then the data we've got coming back this week, et cetera, would confirm that. It's increasing, and prediction is that it'll be the predominant variant spreading in Arkansas certainly by the end of the summer, probably by August.
So do you think that this new increase that you guys are seeing, do you think that that's because of the relaxation of the COVID restrictions?
I think it's probably related both to the Delta variant being more transmissible and more easily spread, occurring at a time when lots of people have been backing off some of the measures that they had been taking previously as things were looking a lot better. And so, we're having more get-togethers, we're having more big parties with lots of people, more crowded situations. Certainly we saw, I don't know how things were in Louisiana, but we saw increases in the state after Memorial Day, a notable. That's been the case throughout the pandemic, not just lately after big holidays where people get together. We're trying to talk a lot about that prior to the July 4th holiday, to get people to heed, to, while they're celebrating, do it a little differently, space out more, do it outside, not as crowded, consider wearing your mask, and encouraging people to wear masks when they're in mixed groups of where not everybody's vaccinated. So trying to do both of those things. So it's a combination of both, I think, and certainly not all of the spread is Delta, right? The other versions of the virus haven't forgot how to spread in the last couple of months, and so they're still doing that. And as we are a little more relaxed in the precautions we're taking, it has more of a chance to spread if people aren't fully vaccinated.
So what's next then for the state?
Well, I think we're trying to get as many people vaccinated as possible, which everybody in the country is trying to do, and we're trying to encourage people that say, hey, realize now cases are going up. This isn't over. This is a reason you need to get vaccinated to protect yourself. Also talking about our young ones under 12 don't have the opportunity to get vaccinated. And so you getting vaccinated for them is an important thing for you to do. Our Secretary of Health was just saying that at a press conference yesterday.
And I know actually something that was mentioned yesterday was that it's actually our younger people that the average now is going down in terms of age when it comes to hospitalizations and deaths. Can you speak to that a little bit?
Yeah, that's absolutely true. As the older population of Arkansas have done a better job of getting vaccinated. Of course, they were able to do it earlier. The average age of those hospitalized has steadily gone down and that's due to more and more elderly people being vaccinated. I think the rate for 65 and older in Arkansas vaccination is 75% has had at least one shot, and 63 or something is fully vaccinated. So as they've done a good job of protecting themselves, they haven't been in the hospital as much, but that doesn't mean nobody ends up in the hospital. And we're seeing now people, I think they said yesterday the average age was 54. So it's come down from 63, 64 at its peak to down to 54. So it just shows that although younger people are less likely to end up in the hospital, they can, and they can get a serious COVID infection. And we're hearing reports of, unfortunately, 30-year-olds, 40-year-olds even dying due to the virus. And so that's just a call for everyone, especially those age groups who aren't as highly vaccinated, to go ahead and protect themselves.
So since we know that there is a lot of the state that still has yet to get vaccinated, what is going to be your advice? Do you think that they should go back to those mitigation strategies? Do you think those should be more heavily enforced? What's your thought on that?
Well, we don't have any, we don't have a mandate requiring masking now in the state of Arkansas. But I think people should still follow the guidance from the CDC and the Arkansas Department of Health. That is, if you're not fully vaccinated, you need to be wearing a mask when you're in public. And for even for those fully vaccinated, if you're in a very crowded situation in the face of the Delta variant, you should consider wearing a mask when you're in those situations, even if you're fully vaccinated. So it doesn't look like we're going to have a legal requirement for such things anytime soon. Maybe that's a possibility for the future, but just urging people, those things that you did that worked earlier in the pandemic, they should still work now. Let's try to re-implement some of those things, at least in settings where you're in public, and be careful.
So since Arkansas is one of the leading states in terms of, lifting that mask mandate, do you think that it will be harder to get people to go back to that?
It's hard to say. I think it certainly would be harder probably to reestablish a mandate, but that's always a possibility. But law or not, I just encourage people as a physician to do the things that help protect your health. And I know nobody wants to wear a mask. It's uncomfortable. We don't like doing it. But if, as physicians, we ask people to do things all the time for their health that aren't exactly pleasant, or we don't really want to do, like exercise, like not eat unhealthy foods. And maybe it's helpful for people to view it that way. Okay, I don't really like it. I don't really want to do it, but it's good for me, so I'm going to do it for a while.
And my last question is, how impactful do you think that these community COVID conversations will be in terms of getting people vaccinated and wanting to get vaccinated?
Well, I'm hopeful. I think it's definitely worth something that's worth a try, and it's not just the Department of Health that's going out doing it, right? It's the governor, it's community leaders, and I think there's an opportunity there. Hopefully, people who are actually on the fence about getting vaccinated will go and listen and ask questions, and then maybe they'll get some information and go, okay, that makes me lean this direction. I'll go ahead and get vaccinated. That's the hope, that those people who aren't sure, because there's still a significant number of those people out there, that they'll come, they'll listen, and maybe get some questions answered, and decide to get vaccinated.
Anything else you want to add or that you think is important?
No, I don't think so.
Perfect. Well, thank you so much. I really appreciate your time, especially since, like I said, I know that you're busy. So thanks so much for doing this with me.
You're very welcome, Destiny.
All right. Have a good one.
Bye-bye.